Hello, and thank you for joining us for Family Forum. Each month, experts from the Sioux Falls School District and Avera Behavioral Health provide practical advice to strengthen families. Today, we're sharing information on the physical and mental warning signs of alcohol and drug use and abuse. In the first few minutes of this episode, we'll be defining the seriousness of addiction based on what we're seeing right here in Sioux Falls. And then we'll provide parents with specific examples about how to talk to your son or daughter about your expectations before any use starts and what to say if you discover that they need help. So let's have our guests introduce themselves today, and then we'll dig right into our information.
My name is Alyssa Dahl. I am the manager of addiction services with Avera. I'm a licensed clinical social worker and a licensed addiction counselor.
Thank you, Alyssa.
Molly Satter, I'm health services coordinator for the Sioux Falls School District.
And I'm Patty Lake-Torbert. I'm in charge of the school counselors, social workers, and Office of Myriad Education in the Sioux Falls School District.
Thank you all for being here today. Alyssa, why don't we get started with just understanding a little bit about the definition of addiction. We might be making some progress, I would hope, in society, understanding that addiction isn't necessarily a problem with someone who has, a lack of moral character. It's truly something in our body systems. Mm-hmm. So talk to us a little bit about how we define addictions.
Yeah, absolutely. So addiction is a brain disease that really affects all areas of someone's life. So biologically, psychologically, socially, and even spiritually. And so with those complex interactions, addiction really is a chronic and progressive illness that isn't going to go away without treatment and intervention.
Okay, and that addiction is something different really than just your occasional first-time use type of thing. But when we're talking about addiction, we're talking about pervasive reliance on something.
Absolutely. That chronic use over time, that progressive use that continues to worsen, lack of control. But like you said, not a lack of willpower by any means, not a moral issue, nothing like that. It is a brain disease with, backed by science.
Right. And so that science behind the addictive behaviors, what's really going on in the brain, or what do we know? What have we learned about the brain's behavior during addiction?
Yeah. So in the brain, addiction works on the brain's reward system. And so also what helps us to survive. And so the dopamine is being released at astronomically large levels when we use substances, and that tells our brain, yes, we need this to survive. So dopamine naturally gets released when we do something enjoyable, like taking a walk, maybe playing video games, something like that, right? And so with substances, though, that's released at a much higher level, and unfortunately, again, tricks our brain into saying we need this to survive.
Right. And so many times we often think that addictions start in the teen years and beyond, and we do start to see some of that happening in students in those teen years. Is that your experience here in the Sioux Falls School District?
Yeah. Yes. Unfortunately, we are seeing that in middle and high school students. We're seeing them starting to experiment with some things, and even students who have kind of gone beyond that experimentation and moved into maybe having some addiction and some problems with the control over it.
Sure. What's the youngest person that you've been working with in your line of work?
For treatment specific, I would say we don't go younger than 11, but certainly see younger ages using substances, maybe not to an addiction standpoint, but we've treated children at an inpatient level, which is the most severe, as young as 12.
Wow. That stops me in my tracks a little bit. A 12-year-old, where we think generally these are developmental years where you're, trying to find out just who you are, but then add a substance to that, and that makes life a whole lot more complex, for sure. What are our school counselors seeing in terms of students and what they might be experimenting with?
I know that it's always been there, right? When I was growing up, it was kind of more cigarettes that were kind of that first thing that people were trying, maybe even alcohol. But I think what we have been seeing the last few years has been more so at a younger age that they were trying that. That might have started high school, maybe a little bit middle school. Now we're seeing that a little bit more in even 4th and 5th grade. and probably the access is there a little bit more so. And so I think what counselors are seeing is that it's at a younger age, and that we actually do have kids that are reaching out for help at a younger age than what they did before. Just as an example, talking about vaping, a few years back, we had middle school admin that were contacting us saying, what kind of help can we get students who don't want to get into trouble? They are addicted. How do we help them? And so I think that's what counselors and building admin are seeing is that younger age and that it's just moved from the cigarettes to vaping. It's still alcohol is a part of that. And then maybe marijuana is starting to be seen more so. Yeah.
Yeah, those are, when we're talking about the most commonly used drugs and those that impact whether or not someone is a user or somebody who's addicted. What do you treat most often in terms of addictions? What are they addicted to?
Among adolescents, we see a lot of polysubstance abuse. So not just one substance, it's a majority of substances. Unfortunately, a lot of illicit drugs for those patients that are needing that highest level of care, that inpatient treatment, meth, fentanyl, things like that. Marijuana is a common one that the teens don't think is as big of an issue, unfortunately. But what we're seeing is like the oils and the more potent stuff than what they had, the time frame you were talking about with cigarettes, right? And so, yes, certainly more potent substances.
What about like prescription drugs and cough syrups and things like that? Certainly something to be mindful of. And I know they've put some limitations in play where I just bought some cough medicine over the weekend and had to give my date of birth, that kind of thing. There are some things put in place for that. But do you see much of that as well, like prescription or over-the-counter abuse as well?
Yeah. In regards to over-the-counter, I would say Benadryl is a big one. Mm-hmm. Obtaining it illegally or legally, right? Stealing it, perhaps. But yeah, Benadryl is one, taking 40 to 50 pills at one time to get that high.
Wow. In terms of the vaping and the oils and the things like that, I think that's something we become in the school district a lot more aware of, those vaping products and tools and that type of thing. We've been working with the city health department. Molly, you've kind of been leading the charge on that, on vaping specifically, but what kind of work has been done in that area?
Yeah, so we've been working with the City Health Department on Break the Clouds, our vaping campaign, and put together some information on their website that is, helps folks who want to quit, if you're looking for prevention, education, all of those things. And we're able to connect our students and families with that via some little business cards that have a QR code that can take you directly to that website with those resources. So that's kind of the first phase, is just getting resources in hands. And so that if a student gets caught or they come and they say, hey, I'm really struggling, which we're seeing more of that, where students are like, I want to quit and I can't. How can we not just take a punitive approach, but how can we connect them with resources? And so that's really been the first goal of our campaign. And then we're kind of moving into how can we educate younger students. So we're starting to see those 4th and 5th grade students who might be, getting into things that they shouldn't be and having questions. And so how do we educate them starting younger? So that's kind of the next phase of our work with the city. So they've been a wonderful partner in getting some of this information out for families and students.
Absolutely. And then when a student does get intercepted with a vaping pen or, some sort of cartridge or something like that, being able to provide them and let them know that, hey, there is help. Yes, this is against school rules, but we're also going to step in. And that's a lot of what our counselors are the role they're trying to fill as well, is not just, the implementation or the getting in trouble for something, but really helping them overcome.
Right. I think the wonderful thing is that when you look at our buildings and you look at the teams that can work with students, from teachers to nurses to counselors to admin, I think everyone has that same mindset. We really want to get kids help. That's really what it's about. And so much of that time then it is, how do we get parents help? Because I do think that some of the things that are happening right now, that stigma is not as strong as it needs to be. There are many kids that we know are probably having issues with alcohol. Many that are having issues that they probably moved on from cigarettes to vaping, and that it appears to be more acceptable. And so then how do you reach out and ask for that help? And so thank goodness there are kids that are asking for help, and there's people within the school system that can help that parent who says, I don't really know what to do. What can I do? And so, we encourage them, contact us, contact the school nurse, contact the school counselor. We'll get you hooked up with somebody, because that really is what we want, is help. We don't want to continue to be punitive with them.
Right. And sometimes then the referral comes to someone at your level that can really work with a family, work with a student in order to get them back on the right track. I think, since the beginning of time, kids have always felt the peer pressure and that kind of thing. What are you seeing with adolescents these days in terms of the stressors that they're facing? And is that what's pulling them into addictive behaviors? Is there any one thing, I guess, that's pulling them in?
I would say you're correct. And I mean, the substance use starts off as the experimentation, trying to fit in. All my friends are doing that peer pressure type thing. When it gets to the point of the addiction, at that point, there's a larger underlying issue, perhaps centered around coping with negative emotions, maybe a past trauma. There's something underlying there. If it's reaching the point of being a diagnosable substance use disorder, it's simply more than fitting in at that point.
Yeah. And so many tragic stories that we hear in our community and even state nationwide of kids falling into patterns, and just one time something can cost them their life. And that seems like it should be enough to shake people out of that, but it often is not.
Often it's the mindset of it can't happen to me, or it won't happen to me, right? Some of those whether we're talking like substance use specific consequences, like an overdose, or just our decision making when, I'm going to decide to get behind the wheel after I've been using, or just make reckless decisions.
Right. And let's talk a little bit about what can happen, or some of the things that we might see as a change in a child's behavior, as to maybe indicating that there might be something going on more than just trying to fit in or whatever. But what are some of the kinds of things we see that parents can use as warning signs potentially? Anything you've noticed?
I think that, and we again have talked about this for years, that isolation. Sometimes you see your child isolating themselves, maybe they're in their bedroom more than that they had been before, trying to hide whatever that addiction may be. They have a change in friendships. Or not. Sometimes maybe the friendships are there, and that could be part of this whole issue too. Also taking a look at how are grades in school. Okay, so I mentioned those, but there's also this whole larger point that sometimes I think we're missing, is that it really can happen to anyone. Mm-hmm. And so we may not see those warning signs because those aren't the warning signs that we're going to see. So it really is trying to engage with your child as much as you can. And then when you do start to see that things are not quite right, to reach out for that help.
Mm-hmm.
So I think from counselor's point of view, that's what they take a look at. I'm not sure, maybe nurses see something too with more health. I'm not sure in school.
Yeah, certainly nurses can look for the physical manifestations of what's going on with this student, and parents might see, pupil changes, nervousness, kind of on edge, maybe extreme sleeping patterns, or awake more than you would normally see them, just kind of those changes and that you might see physically with them. Our nurses are able to look for those, but parents should kind of be aware of those as well. Mm-hmm. And knowing that could be indicating something more is going on.
I think it's, if for any parent, you think, oh, I would notice, or I would see if there are warning signs or things. And then when you find out that something isn't quite as you think it is, you think that guilt sets in, and you go, how did I miss this? Why wasn't I seeing this? Do you work with families on that as well, and those feelings of, oh my gosh, I can't believe I didn't know this was going on?
Yeah, absolutely. Addiction, if it's to the point of being an addiction really is a family disease, because it impacts, like I said, socially what's going on around us. And so it impacts the entire family, not just the adult or the adolescent that's struggling with substance abuse. And so our programming, we involve a lot of the families in the programming in order for them to receive education, but also that support that you're talking about in regards to how do I best help my child? How do we work collaboratively to solve this issue or care for the patient?
Yeah. So what should a parent do if they are faced with the knowledge that or suspecting that their child is using? Is it something where you want to approach it immediately as it's happening? Do you want to get your ducks in a row and your talking points and thoughts organized? I think it's we don't know exactly what to do, but what do you advise for parents?
That's a tough one. I would say if the adolescent is under the influence at that point, waiting until the substances are out of their system, right? Because if they're under the influence of alcohol, marijuana, other drugs, that conversation's not going to
be productive.
Yeah, exactly. And so first and foremost, waiting until they're not under the influence, but then attacking it head on, right? Just being open and honest, using the evidence of what you're seeing. You had mentioned some physical signs. I've just noticed that you've been sleeping more or that your pupils are dilated or whatever that may look like, in order to, tell them exactly what you're seeing so that they know that you know what's going on.
Right. And maybe just like you said, facing it head on without sort of a gotcha kind of approach, but more matter of fact. Seems like when we take that approach, it's like, okay, I've seen this. This is what I'm suspecting. Tell me if I'm right or wrong. Is that kind of how you go about it?
I would say in that regard, providing the facts, but being understanding, right? Making it more of a therapeutic conversation. And I mean, parents aren't therapists, but making it more understanding of, this is what I'm seeing. I'd like to help you if there is something going on. And like I said, if it is to the point of addiction, what is the underlying cause? What do we need to help you with? What care do we need to provide you in order to figure out how we provide that care?
And we're hearing from students a lot more anxiety and stress in their world. And so coping strategies and things like that, we're really trying to help young people develop those skills as well. But how can a school support a family who might be working through these challenges as well?
Right. Well, I think, again, kind of coming from the counseling world, is to be able to reach out to that counselor for your child and to try to be as honest as you can. Saying, I'm worried, I'm concerned about this, so you can get maybe more of that direct information as opposed to maybe Googling it. Sometimes I'm not quite sure how well that works, but to be able to get that information and then to get that support on the information that the parent needs. Now, I think when it comes to what we're providing in a school, there are so many places all the way from curriculum, right, to talking to students individually, talking to students in groups about what the help is and what it looks like maybe in your life. Because again, it can look really different for kids. For some kids, it may manifest itself more in depression and looking like I'm really sad, lonely type of thing. Where in other kids, it could be a drug that, let's say caffeine, where I'm drinking a lot of caffeine to get myself through the day, and then I'm not sleeping as much at night. And so to have those really extreme conversations about what's out there and how it's affecting us. And so trying to help the student as far as, where they're at in the system, but then what information can we provide for the family and the kids.
What are the level of treatment options? Is it categorized? I know you said, outpatient, inpatient, what are the levels of treatment that are available and how do families access?
Yeah, absolutely. And so inpatient is going to be the highest level of care, the most intensive, something where they need to be in a structured environment and really immersed in treatment for 28 to 45 days in order to stabilize any maybe medications or medical concerns, mental health concerns, and also receive that co-occurring addiction treatment. After that, there is several levels of outpatient care as well. There's intensive outpatient and then like aftercare type groups, as well as individual therapy There's even prevention and diversion type programs that are available to, if we're able to catch it early. Maybe there's been 1 or 2 uses and we're trying to provide education early in order to prevent it from forming into a substance use disorder.
Sure. What are some of the coping strategies that people can use to reduce their dependence on these types of substances?
A lot of what we promote through our addiction treatment programs is identifying what's causing us to use. So what emotions are we trying to cope with? What's going on in our environment that's causing stress, right? So a lot of stress reduction, a lot of coping skills related to maybe like emotional regulation, right? If I'm angry and I turn to substances, how do I address that anger or whatever emotion is underlying that anger? How do I take care of that so that my choice isn't to turn to substances? My choice is a healthier option.
Right. I know one of the things that we've talked about in this vaping campaign is like you almost have to educate yourself as a parent because your kids know these things are out there. The kids know where and how to get access to these substances. And in the vaping world, it's like a total new education that parents have to dig into to even find out about the types of tools that kids are using to vape, or the types of products that are out there that can lead to substance abuse. It's like a full-time job trying to stay on top of all that.
Yeah. I mean, there are so many different things, and there's something new all the time, whether it's a water bottle that's actually a vape device, or a hoodie that has the string that you can vape out of. I learned recently of discreet shopping. So a minor can go onto TikTok, order something that might look like makeup, for example, but it's actually got vaping devices in it. So there are so many ways that kids can get a hold of these things that I think most parents are not even aware of that's even an option. So just making yourself familiar with and aware of kind of the new and upcoming things. And like I said, it's always changing. So.
Yeah, those are devices and substances too seem to be evolving over time. I mean, it's not just your plant-based marijuana, but all of these different oils and like you said, things that I know one thing we talked about, kind of a new knowledge for us, was Zens and a tobacco-laced product. It seems like there's always something new coming up. What have you noticed over time that it gets trickier and trickier to work with these situations?
As a clinician, it's hard for us to assess how much they're using of some of these substances. It's pretty easy to measure if you smoke 5 cigarettes, but if you're puffing on a vape, it's hard to measure. We can say how long does it take you to go through a vape cartridge or a marijuana pen, but how potent are those, right? What percentage of THC or tobacco or nicotine are in those products, right? It makes it harder for us to measure how much they're using and to make an appropriate recommendation.
Right.
Sometimes. And they're not sitting there tallying how much they're using either, right?
Right.
And they're not always aware of what they're using because they might think they're just vaping tobacco or marijuana, but then it's laced with something else. And so pretty soon, I mean, they're using things that they weren't even aware of. And, there's a real concern with that and overdosing and those kind of things when, they're not sure what it is they're getting into.
Absolutely. Many times we hear, that where did kids get access to this from? Yes, they might be making a purchase from a friend or, something along that line, or purchasing, like you said, discreet shopping. But we also know sometimes they're getting it from an older sibling or even a parent who has that device or substance around. What would you say to parents about that?
I think, yeah, certainly depends on what substance we're talking about. Obviously, alcohol is a large part of our society. And so it's in a lot of homes or in most gas stations that you drive by, all of those things. Marijuana, I would say, typically coming from friends or social connections. Snapchat, right? My dealer's on Snapchat, perhaps, is what they say. Nicotine, same thing, friends. Connections that way.
Yeah, so we just need to be aware of where our kids might be, getting access to these things, and really paying attention to that as well. And if it's a situation that's in the home, making sure that the adults are the only ones that have access to that and that type of thing, so it doesn't become a substance of abuse. What if a parent's watching this and identifying in themselves that they've got their own work to do personally because of an addictive behavior? So how do they get help, and how do they get help for their child? What are the steps they need to take?
I think if we're recognizing our own addictive behavior, first of all, it takes a lot to admit that there's some sort of problem, right? From there, it can be very daunting to reach out for help, but we do have a lot of different avenues for care. First of all, I would reach out to a professional in order to get an assessment completed to determine where you're at, right? Because the answer to care isn't always inpatient treatment. And so a clinician can help determine what is appropriate for you and where you're at in, with the severity of the substance use and the problems that are occurring because of it. And so reaching out to an assessment, we do assessments at our outpatient clinic. Our inpatient unit can do phone screens. And so there's plenty of options for accessing care.
And is that the same process you'd use for adolescents as well?
Yep, absolutely.
Okay. And assuming you have to have a parent, what happens, as we've been talking about, we have 10-year-olds who are recognizing that they're having addictive behaviors and that type of thing. Obviously, a parent needs to be walking right alongside a child when they're going through this.
Yeah.
That support is important. Yeah, absolutely. Any final thoughts that you'd all like to add about how people should get help, what they should do, any warning signs, anything like that just kind of cap off this conversation?
I'm just going to say I love what the conversation about that. This isn't about parent shaming, and because I think many times with addictions it is kind of like, okay, what could have I done? What didn't I do as a parent? And it's not about that. It really is now just very calmly, as calm as you can, getting that help that you need for your child, and to take that step, make that phone call, whether that be to calling Avera, maybe calling the school to talk to a nurse or a counselor and saying, how do I get this help for my child? Just do that. Just make that step.
Yeah. And I would say, for those students and even the parents, finding that trusted person at school. And so for some students, that might be our school nurse, and know that in that process, the nurse is going to involve the parent and the counselor, and they're going to come together to support the student. So there are a lot of different staff members who are here to help. And we want to partner with you and your child and get them the help that they need. So
absolutely. And our valued community partners who are experts in the field are ready and waiting to help families through this situation. Wonderful. Well, when entire families are well, day-to-day stressors decrease, and we can start to see the sunshine through any clouds of despair that might be out there. So we hope you find this information helpful for you and your family. Please reach out through the information on your screen. Sioux Falls Public Schools and Avera Behavioral Health are ready to help turn things around for you and your family. Be well.